Hi, I'm Andrew Oberholzer. Welcome back. I head up the Men's Health Association in South Africa, and today we're talking about that very interesting part of our male anatomy. That's the penis. It causes us a lot of problems, also gives men a lot of pleasure. Now, first of all, important to understand that your penis probably isn't as important to your partner as it is to you. Have you ever gone on a date and before you go out, the girl or lady comes to you and says, "Please take out your penis"? It's too big, it's too small, it's the wrong shape, I'm not going to go on the date with you. Okay? Doesn't happen. That lady's actually interested in you as a person. She wants to see if you've got a sense of humor, if you have common interests, if you can converse together. Your penis isn't everything. It's important for guys as they get older to realize that their penis is also getting older. So I often have older guys over the age of 50 coming to me at a wellness day saying, "Andrew, I've definitely got a problem. I can only go 2 rounds a night and then I can't get it up again." He doesn't have a problem. That's normal aging. So what happens is that period after you've ejaculated until you're able to get the next erection is called the refractory period. So maybe when you was 15 or 16 it was 5 minutes. Now it could be 5 hours or even a whole day. That's perfectly normal. What we are concerned about is if you can't get an erection or keep an erection long enough for satisfactory sexual performance. When I started the Southern African Sexual Health Association, we had a telephone helpline. Guess what the most common query was that we had? How can I make my penis bigger? Research actually shows that most men, when they have an erection, will end up at around 13 centimeters. But you get showers and growers. So that guy that you see in the shower in the gym, who's got a long, soft, flaccid penis, isn't going to double in size when he gets an erection. The guy with the smaller penis, that's going to grow a lot more. And most women, when they're asked about penis size and how important it is, are actually satisfied with their partner's penis size. Most men, however, are not. So that obsession with penis size is in your head, not hers. Only the first third of a woman's vagina is actually sensitive. So all that extra length is just wasted. About 50% of women, in fact, can't have an orgasm from penetrative sex. They need other types of stimulation. So your penis isn't a magic wand after all. The most common penis problems are erectile dysfunction, premature ejaculation, delayed ejaculation, and of course, sexually transmitted infections. Let's start with erectile dysfunction. About 50% of men over the age of 40 will experience erection problems or erectile dysfunction at some point. Erectile dysfunction is simply defined as the inability to keep or maintain an erection or to get an erection that's sufficient for satisfactory sexual performance. If you are having problems with your erections and these are persistent and ongoing, it's extremely important that you see a medical doctor. Problems that start in the penis are likely to be due to an underlying more serious health condition. So if you're experiencing erectile dysfunction, it's normally a problem with blood flow. The risk factors for erectile dysfunction are in fact the same risk factors for heart disease. Things like smoking, high blood pressure, diabetes, not getting enough exercise, not controlling your cholesterol. All of those factors can affect your erections, but they can also affect your heart. Your penis will often be the first place that problems with your cardiovascular system will show. That's why we say to men it's so important to see a doctor. We know that guys who have erectile dysfunction, if they don't have any treatment, within 5 years are likely to have a heart attack or stroke. It's not a problem to treat the erection problems. It is important for us to see what's causing them though. If there's any problems with your penis, don't leave it. The problem is probably not going to go away, and in fact the problem is likely to get worse, not better. So if it's leaking, if it's got something growing on top of it, if it has a sore on it, if you can't get it up, see your doctor. They're there to help you. Treatments for erectile dysfunction today are actually quite simple. There are a number of different tablets available. We call these PDE5s, and there's a couple of different ones that work slightly differently. If the oral tablets don't work, there are other options. The important thing to know is there is help available. See your doctor. If your general practitioner can't help you, they'll probably refer you to a urologist who will be able to offer you different treatment options. But there's always hope.